This is critical thinking on urinary physiology, and here are the questions. Here's the first one, the second one, and the third one. So let's look at the first question where we are talking about this situation where a person has lost a lot of blood, and to maintain homeostasis and also what is called hemostasis. Hemostasis is when you maintain blood volume and blood pressure. Homeostasis is when you maintain the entire internal environment, and so it also includes hemostasis. So I use the broader term homeostasis. So to maintain homeostasis, which of the following would not be stimulated? So let's first look at what happens when a person loses a lot of blood. So when they lose a lot of blood, the blood volume automatically decreases, and therefore the blood pressure also decreases. At the same time, this is seen by the body as an emergency situation. Now, if you remember, in all emergency situations, the sympathetic nervous system kicks into action. So the sympathetic nervous system would be stimulated, and what it will do is it will cause vasoconstriction of the blood vessels all over the body. Now, when it causes vasoconstriction, automatically that increases the peripheral resistance. When peripheral resistance goes up, the blood pressure will go up. So it tries to rectify the situation. So blood pressure has fallen, so it will increase the blood pressure. At the same time, what you want to do is blood volume has decreased, so you want to bring the blood volume back to normal. So in the kidneys, what the sympathetic nervous system will do is that here you have the glomerulus, and you have the afferent arteriole, which feeds in this was the Bowman's capsule. So this is the glomerulus with the afferent arteriole feeding in, and then the efferent arteriole exiting. So normally the efferent arteriole is much narrower than the afferent arteriole. In an emergency situation like this, the sympathetic nervous system acts on the afferent arteriole and constricts it too. So when it constricts it, obviously less blood will flow through the afferent arteriole and into this network of capillaries. So the pressure in this capillaries, the filtration pressure, will decrease, which means less will be filtered out. So we have the glomerular filtration rate will decrease. When that decreases, less urine will be formed. So there'll be decreased urine formation. When less urine is passed, obviously less fluid goes out of the body, so that will help to bring the blood volume back to normal. And if you look at it as a common sense situation, when you've lost a lot of blood, you do not want to lose more fluid by passing a whole lot of urine. So the body reacts by passing as little urine as possible, so that you can try and bring the blood volume back to normal. And that's how the sympathetic nervous system acts. Let's look at the next situation. Now, this decreased blood volume and decreased blood pressure affects most of the body. And you can see here, as the blood volume is decreased, less blood will pass through the afferent arteriole. And if the less blood is passing through the afferent arteriole, automatically you can see that the cells in the afferent arteriole, the JG cells, they sense this lowered blood pressure. When they sense this lowered blood pressure, they secrete renin. This renin goes and activates angiotensin, and the renin-angiotensin mechanism kicks in. When the renin-angiotensin mechanism kicks in, that causes release of aldosterone. So you can see that renin will be secreted in this situation because of the decreased blood pressure and blood volume in the afferent arteriole. So this will also be stimulated. And we just said that aldosterone, because of the renin-angiotensin mechanism, aldosterone is also going to be secreted. And how does aldosterone help? What aldosterone does is it causes reabsorption of sodium, and with reabsorption of sodium, water also follows. So when water follows, into water is reabsorbed at the distal convoluted tubules and the collecting ducts. At that time, what happens is that the amount of urine passed out is less, so urine volume decreases. But at the same time, because fluid is reabsorbed, your blood volume comes back to normal and your blood pressure also slowly increases. So aldosterone also helps in this situation. And let's look at the last situation, which is where not last, this is the fourth one, where ADH is secreted. ADH secretion also occurs because, again, because of a lowered blood volume and lowered blood pressure, the osmotic pressure of blood rises and the osmoreceptors sense that, and they cause ADH to be released. ADH again acts on the distal convoluted tubules and the collecting ducts, causing reabsorption of water with less urine being passed. When water is reabsorbed, that causes, again, helps to increase the blood volume and hence increase the blood pressure, and hence the situation gets rectified. So the first four will happen. That means there will be, nervous system will be stimulated, renin will be secreted, aldosterone will be secreted, and ADH will be secreted when a person has lost a lot of blood. What will not be secreted is ANP, or atrial natriuretic peptide. The reason being, the function of atrial natriuretic peptide is to secrete sodium and hence water into the renal tubule, and then this passes out in the urine, so you have copious amounts of urine being formed. Now in this situation, you do not want to lose water and you don't want to lose sodium, so you hence don't want ANP to be secreted, because ANP is actually an antagonist of ADH and aldosterone. So therefore the answer to this question is ANP will not be secreted. Let's look at the next question, where you have to identify the false statement. So here, the first one is a constriction of the afferent arteriole will cause decreased filtration, and this is true. And we just saw in the, as I said in the previous question, if you look at the Bowman's capsule, and here is the afferent arteriole and then the efferent arteriole. So if there's a constriction of the afferent arteriole, less blood is flowing into the afferent arteriole, hence into the glomerulus. Automatically the filtration pressure will decrease, and hence the glomerular filtration rate will decrease. So this is true. The next one, which says drinking excessive quantities of alcohol or water produces dilute urine. This is also true. And if you think of this, if you drink too much water or alcohol, your body has more fluid than normal. So what it will do is want to get rid of that excess fluid, and it can do that by passing more urine. And in that case, the urine becomes dilute. At the same time, alcohol by itself also decreases ADH secretion. Now, when it decreases ADH secretion, what will happen? The distal convoluted tubules and the collecting ducts become impermeable to water. When they become impermeable to water, water is not reabsorbed. Hence, it is passed out in the urine. So you do produce copious amounts of urine, which means that there is dilute urine. Let's look at the third statement, which says a massive hemorrhage results in decrease in the volume of the extracellular compartment. This is also true, because the extracellular compartment consists of the fluid in the blood vessels and the fluid in the extracellular tissue spaces, so extracellular spaces. So when you have a hemorrhage, fluid is lost from the blood vessels, hence the extracellular fluid volume will decrease. So this is also true. Let's look at the fourth statement, which says that Tanya's metabolism has gone up due to heavy exercise, and this leads to a decreased respiratory rate. Now this is false, because if you just look at it, when one exercises, you notice that your respiratory rate goes up. The reason being that when you're exercising and the tissues are metabolizing more, tissue metabolism produces more CO2 if there is increased metabolism. Now, when there is increased CO2 production, this equation H2O plus CO2 will lead to H2CO3, which will form H plus and bicarbonate ions. Now, if you have more CO2, that means more hydrogen ions will be formed. So the body does not want more free hydrogen ions to be formed. If it does, what will happen? The pH will decrease and it will lead to acidosis. So the way to get rid of it is that if you were in some way able to get rid of this excess CO2 that you're forming, and the respiratory system helps that way. So what the respiratory system does is it causes hyperventilation. So whenever there's increased exercise, a person hyperventilates. When you hyperventilate or increase your respiratory rate, all of this excess CO2 that's being formed, it's expired. So the hydrogen ion level is not allowed to go up. The kidneys can also help, and what they will do is they will secrete this hydrogen ion into the lumen of the kidney tubules and pass it out in the urine. So that also is one way that, the hydrogen ion levels, the free hydrogen ion levels are prevented from going up. But in this case, we're talking about the respiratory system. So increased metabolism will lead to an increase in respiratory rate and not a decrease in respiratory rate. So hence that statement is false.